Always low, low prices at Pahrump Valley Auto Plaza.
Better news. Even though Nye County continues to be currently in a flag status, we are improving. Our COVID trajectory has stabilized. We have a significant reduction in a number of new cases. I will just say with caution that we do have several additional deaths that have been reported. Our total case count is 2,734, which includes 93 deaths. Our hospitalization in Pahrump is also stabilized, and several new cases, however, do remain in intensive care in Las Vegas-based hospitals. Our testing continues. However, we are experiencing a reduction in those willing to be tested or wanting to be tested. Most are symptomatic now versus the traditional asymptomatic also being tested. Vaccinations continue following our COVID-19 vaccination plan, which was approved and is closely monitored by the state. Nothing has changed with that. Receipt of the vaccines remains limited, and Chairman, I heard you say a little earlier, you stated to the remainder of the commissioners that the vaccines were, in fact, not received for this week due to the weather conditions across the country, and that is absolutely accurate. We have not received any of the requested allocations for this week. We are cautiously optimistic that we may receive them by the end of the week. However, that will not give us sufficient time to organize a pod before the weekend, which is the VA pod. Pahrump Fire has also been working diligently with the veterans. The VA clinic has held at least one pod, actually two pods held over one weekend, and they're scheduled for more this weekend. I believe they vaccinated 400 people over the 2 days, and I think they intend to do the same this weekend. And that is also by appointment, and it will be at the Veterans Clinic located in Pahrump on Lola Lane. But again, appointments are required. All of our vaccinations are completed by appointment and are supported by the back pocket list. If you've heard me talk before, our back pocket list has been extremely important to us because our intended goal is to never ever have to waste any given dose of vaccine. So in some cases where people didn't show for their scheduled appointments or something else has arisen, there are cases where we may have several vaccines available toward the end of the day. We then go down through our tiered list and our lanes, try and get people in the last minute, because once we draw that vaccine out of the vial, we have to use it within 30 minutes or it's no longer valid. So we take into consideration where they're coming from, how quickly they can come in. So how do people get the vaccine? It seems to be an ongoing question. NevadaCovidFighter.org or NyeCounty.net or the websites. You can go in and schedule your appointments following the respective banners and the steps outlined. For those without computers, we have two telephone numbers, 1-800-401-0946, and our local number of 775-751-6313. For our homebound seniors and others that are unable to gain way to some of the pods, we are working closely with our senior center, our pharmacies, our transportation companies, medical groups, family members, and word of mouth to help identify and overcome those vaccination challenges. We've actually had a number of the transportation companies bring those people directly to the pods, and we move them to the front of the line so they have a reduction in the cost of sitting there in a cab or a taxi.